show is Dr. Vivek from the PIIC Center. Good morning, Doctor.
Good morning.
Well, it's good to see you 2 years after the initial. I think we all look a little happier than we did.
Definitely.
So we're definitely in a lull. Is it the final lull?
I hope so.
I hope so too.
Don't know, but I think if you look at the previous pandemics, typically it's a 2-year cycle, and with the second year being worse than the first year. So I think we are probably in a true lull, but time will tell.
We're seeing cases on the rise in Europe, and that has got to be complicated by the war. That's it can't help. It certainly is not going to make it safer.
Yeah, I mean, any social upheaval is a very ripe, fertile ground for pandemics to spread. And you have individuals kind of mulling around, kind of going to different places. You don't know what their vaccination status is. The underlying situation in terms of food and water supply, sewerage is also not the greatest. So it's pretty easy for infections to spread in that setting. Now, hopefully, SARS is not going to be the big player right now, but I think you're going to see an uptick in numbers for COVID, definitely. The question is whether it'll be the same thing that we saw 6 months ago. I hope not. I mean, there are newer variants that are going to be spreading around, but with majority of the world, hopefully, at least in our neck of the woods, being either vaccinated or having had disease, the next uptick, I think, is going to be milder.
I remember at the start of the pandemic, we learned that these viruses mutate until they can become something like the common cold. Or is it too early to call it that, or we'll still
it's too early. I mean, I think part of the stuff I wouldn't make the case that the pathogenicity or the virulence is decreasing. Mm-hmm. It's just that we are becoming stronger.
Sure.
I mean, our immune system is catching up with the virus, so we are becoming a little bit more attuned in trying to fight off this infection, whether with vaccine or whether from your own having had the disease. But the virus itself is still virulent. So, I mean, if you have individuals who've never been exposed to the virus or have never had the vaccination, they're still going to be in trouble. And we are seeing that played out best in individuals whose immune system is weak, partly from chemotherapy and everything else. So those are the individuals who are still getting sick.
The pandemic, it's affected everyone differently. You've had some people that have been afraid to leave the house for 2 years. You know, it's kind of overcome their life. How can they get out of something like that? Is that just creatures of habit? I
mean, it's creatures of habit. If you have an underlying tendency to be very anxious, the pandemic hasn't helped you. I mean, it's in fact exacerbated that. Mental illness has been kind of the hidden pandemic, which has been underlying this overt pandemic that we are seeing. So, I mean, I think it's something dipping your foot out in the water and then gradually stepping out into the water, knowing that there's going to be some setbacks. I mean, my sister-in-law hasn't moved out of the house for 2 years, and my brother, when he started going back to work, she's been having heart attacks on a daily basis. Mm-hmm. Kind of if his nose runs, and she freaks out.
Yeah, mm-hmm. Yeah. You see a lot of that, and it's some folks have had 2 years of isolation, and that is not normal for humans, correct?
No, I mean, I think, and definitely. I mean, we are creatures of social habit, and if we could live in isolated caves, we would have done that all our lives.
At what point does the pandemic shift to being an endemic?
I mean, I think we'll find out. I personally feel that this fall is when we'll know kind of whether we're going to have low-level cases like the flu. So we'll have to see what happens in summer.
Our attitudes about the pandemic have changed as well. There are still people who won't leave their house, but we're all washing our groceries. In the early days, people are they're exhausted and I think a lot of people are just living, we're going to live our life, we're going to live normally, and pandemic or not. Our response to the pandemic, is that going to impact how the pandemic could potentially end?
Well, I think we are seeing people move out anyway. I mean, I think we've reached the limit of our tolerance for staying inside. So that's happened. I think what's going to change personally is the fact that you'll probably see a lot more people kind of wear masks where there are a lot of people around. So airports, kind of stations, concerts, you'll see people wearing masks a lot more. So that, I think, is going to be one long-term benefit, I think, from the pandemic. Kind of, we have a heightened appreciation of what viruses can do. The other thing is, I suspect people who think this was much ado about nothing will still have that attitude kind of stuff.
I think Hawaii is the last state to kind of remove the mask mandate. A lot of people are calling for airlines to remove masks, and you can read a study about whatever you want.
Yeah.
I read one saying that the air circulation is really what protects you in the plane, and what are your thoughts? It's tricky. You have all those people with masks eating.
The air circulation is definitely the key thing that protects you. The trouble is going to be if you've got somebody next to you coughing, that air circulation isn't going to protect you.
Okay.
The question then people will ask is, does the mask protect you against that?
Right.
I mean, I think in some ways decreasing the risk of spreading the disease is probably the bigger thing. I mean, if you wear a mask and you're the sick person, that's probably more protection than cloth masks on somebody who's sitting next to you.
Well, anyone that remembers the days where you could actually smoke on an airplane knows that the air does not completely heal itself in minutes on an airplane.
Well, it's an airplane.
Well, it fills with smoke. I mean, it was a joke to begin with, where there was a cardboard divider, no smoking beyond this point.
Right.
The whole plane was full of smoke.
Yeah, well.
If you traveled, you got off a plane smelling like a bowling alley.
Well, that was just the way of life back then, I think.
That was the way it was.
Everyone smelled like cigarettes. That's just the way it worked.
Yeah, you just stood next to the toilet and smoked there. Kind of.
Yes. 17 members of Congress are suing the CDC, seeking an end to the federal rule on the masks on airplanes. They filed a suit Monday. They asked the court to step in and lift the rule. The members of Congress, who are paid $174,000 a year, said the cost of purchasing masks caused them ongoing financial harm.
Interesting. Yeah, one thing I'm worried about, and we're getting a little off topic here, but is now that mask mandates are gone, I'm worried about the more videos that we're going to see from the airplanes of people not willing to wear them.
There have been over 4,000 incidents on 4,000.
Yeah, so I do enjoy watching some of those videos, but I am glad that I'm not on any of those planes. So I think it's just a wait and see. Honestly, I think at some point in the middle of the summer, we'll see. They'll probably lift it, and we'll go about our business. But
yeah, I mean, I think anybody who knows what's going to happen in the future, I would buy whatever they're selling because they obviously know a lot more than anybody else.
Yeah, they're experts. But even before the pandemic, I remember traveling, a lot of Asians were wearing masks even before the pandemic when they traveled. It was just common.
It's pretty common. I think if you're from Southeast Asia, you'll frequently see people wearing masks, and it makes sense in some ways. I mean, respiratory viruses, especially if you're a reasonably good quality surgical mask, you're less apt to get it. I mean, I think in the hospital setting, if you are admitted with a respiratory virus, before all of this started, you were put in a room and anybody who visited you was wearing a mask. And it did help in decreasing the risk of acquisition of the disease. So I think wearing masks in crowded settings is something that I'm going to be doing, partly because, I mean, viruses, forget flu and COVID, typically make you miserable for a week to 10 days. And if you can avoid misery, wearing a mask is a very small price to pay.
Yeah, I think, people forget that during the last 2 years, a lot of decisions and a lot of things are trying to be made in real time, and a lot of things going on. So, of course, not everyone's going to want to be on the same page. We are going to be right back more with Dr. Vivek from the PIIC Center after this quick break.
You never think about a good tow truck service until you really need one. Jimmy's Towing and Auto Repair in Jackson will be there for you in a flash. Our technologically advanced GPS software enables us to pinpoint your location and dispatch the closest truck to assist you in no time. Jimmy's has the largest towing and rescue truck fleet in the area, and we have the right equipment for any towing need. When you need help in a flash, call Jimmy's. Jimmy's Towing and Repair in Jackson.
Someone once told me that every community needs a strong hospital, a strong college, and a strong bank. County National Bank is that bank. CNB provides outstanding personal banking services and is the bank of choice for several nonprofit organizations that serve our communities. It's an honor to be part of the growth of the communities we serve in Jackson, Hillsdale, Lenawee, and Calhoun counties. And we're proud to help local businesses expand and succeed. CNB is banking that stays in the community.
When you need metal, and you need it now, Alro Metals Outlet is here for you. When your back is against the wall, our vast inventory of aluminum, steel, plastics, and more will help you get the job done. Whether you're a professional or do-it-yourselfer, our retail stores are your one-stop shop for metals. You select it, we cut to length, and shear to size. Right here, right now. Because when you need metal, Alro Metals Outlet has your back.
As a proud partner of Frankenmuth Insurance, Barker Weber operates under 5 distinct values.
Integrity. We will be honest and fair.
Stewardship. We commit to responsible management.
Empathy. We understand how you feel.
Mutual respect and trust. You'll always be our valued partner.
Dedication. We'll work for you wholeheartedly.
Barker Weber and Frankenmuth Insurance, your local insurance solution.
We're joined by Dr. Vivek from the PIIC Center. Dr. Keck is an infectious disease specialist. So COVID has quieted down a little bit around the office, but you're still busy.
Yeah, I mean, there are other infections. As I tell patients that if you see us, it's never a good sign. But we see a fair amount of people who are not in a good place.
Yeah, I feel like the only disease I have even thought about in the last 2 years was COVID. I forgot everything else existed.
Yeah.
Mm-hmm. So Pfizer wants to get approval for a 4th booster dose, and it's likely to get approved, isn't it?
Yeah, well, I mean, the data is reasonably clear that there's waning of immunity kind of down the line. I mean, the question often is how much does the waning of immunity correlate with developing severe disease after getting exposure? We don't have that data there. But I suspect there's going to be a 4th dose approved, and significant people will get it. I mean, whether 100% of the people who got the 3rd dose will get the 4th dose, I don't think that's going to happen. Mm-hmm. But I would say probably 50 to 60% will get it.
I know there are people who are already have received the 4th dose, people that are immunocompromised. And we've got, in terms of the safety of the vaccines, in the year and I guess 15 months that we've had the vaccine, has it been proven safe?
Yeah, I mean, it's probably one of the most safer vaccines that we've had so far. I mean, in terms of long-term side effects, at least in the last 18 months, we haven't had any. The issue with myocarditis or heart inflammation in kids has been typically related to mainly kids, self-limited, meaning they get over it, and that can be decreased by extending the interval between the shots in kids. So I think overall we know that it's been a fairly safe vaccine, and so far there hasn't been any signals about long-term concerns that people were raising. So the question though is going to be how long will there be a 5th dose of vaccine down the line? And I don't know, I think we might have a different set of vaccines come down the pipeline which probably give you more long-term immunity than these sequential 6-month doses, because I mean, people are going to be tired if you keep on saying every 4 months you're going to get a shot.
Yeah.
Well, we'd be at a point, when you look at the start of this pandemic, where we started to see places like China and Italy get overrun with the disease before it reached the United States, that a vaccine would roll out to protect a population before it hits the shores.
The short answer, I think, is going to be yes. If you think of the flu vaccine, each year the flu vaccine composition changes, partly based on what's been seen in the southern hemisphere. So now sometimes the time frame is pretty short that the people who make the estimation what the vaccine strain is going to spread can be occasionally wrong. But typically with most respiratory viruses, and I'll use flu, southern hemisphere hits, then it comes to the northern hemisphere. So let's suppose the next pandemic happens in whatever year, and it starts somewhere. By the time it reaches the States, I think you're going to have 3 to 4 month lag period. And with the mRNA technology, I think you could develop a vaccine during that time. The question is going to be whether you'll have the data to say that it's efficacious, and more importantly, whether it's safe. I think you could, the technology is pretty safe, so you could get a vaccine that could be deployed before the disease hits. So that's definitely going to be happening. I mean, I think the technology is there that you could develop a vaccine within 8 to 12 weeks.
Yeah, it's amazing.
But then it becomes a question of whether people will
Exactly.
get,
I mean, that's a separate question, whether people will be willing to get the vaccine. I think it all depends on the severity of the disease that you're trying to fight. I mean, if it's something, for all its mortality, I still think COVID mortality was 0.4, 0.5%, so 4 in 1,000. If you have a disease that has 10 times that, or even 20 times that, 4%, 10% mortality, people will be more willing to get the vaccine.
like Ebola.
Oh yeah, I mean,
or flesh-eating disease, where people's flesh dropped out their bones.
Is that something?
it might be a movie. I'm not
Yeah, I
sure.
think it sounds like a movie. I don't think I've seen anyone with that disease.
I think that's The Mummy.
Yeah.
Well, if there was a vaccine against that, I would take it.
I'm sure you would. I'm sure you would.
We also have pills.
Yeah, I mean, I think there are 2 different oral options. So there are a lot more. We are in a better place for uptake in COVID numbers than we were even a year ago. So there's oral options, the monoclonal antibodies, there's the vaccines. So we are in a definitely better place. And I think overall, even if there's an uptake, it's not going to be like either the Delta or the initial Omicron variant. So we'll be in a better place to kind of fight if it happens. I hope it doesn't.
When the pills first became available, very limited protocol on who could get the pill, and it was hard to find. There weren't that many.
Yeah.
What's the state of that now?
It's gotten better now. Partly, I mean, I think the numbers have decreased, so the number of people who need the drugs is obviously lower, and the supply chain issues and the production of the medication has increased. So it's kind of, I'll use the monoclonal antibodies. The criteria were very strict initially. You had to be a risk factor, so they have kind of loosened out. So if you need the monoclonal antibody or if you need the pills, I think you can find it these days much more easily.
People, can they ask for it, or is it going to be your provider that makes the determination?
Well, you can ask. I think there's criteria for it, but most of the time, if you ask for it, you should be able to get it. Because the people who are getting the disease right now, a lot of them are kind of fairly young going about. But if you fill the criteria where the risk of you kind of getting significant disease is high, you should be able to get the drug without too much issues.
And there's still people, there's about 700 people in the state of Michigan in the hospitals right now.
Yeah.
At Henry Ford Health System overall, it's about
less than 50.
Yeah,
it's great.
And here in Jackson,
less than 10.
Yeah, it's great.
But still people on ventilators.
Yeah, I mean, a lot of the stuff that people, once you get COVID, I think unlike the flesh-eating bacteria stuff, you don't get sick very quickly, nor do you die very quickly. So if you get on the ventilator, you stay on the ventilator for a fairly long time. It's in weeks. We've had patients who've been on the ventilator for months on end.
Oh my gosh.
That's crazy.
Yeah, there was a patient in Arizona who just got out of the hospital.
Well, that's good news.
After 550 days. 45-year-old guy, healthy otherwise.
Well, thank God he's out.
Yeah, he was in
Good.
9 different
That's amazing.
9 different hospitals for 550 days.
Thank God none of the doctors gave up on him.
Yeah, which is a good thing. I mean, I'm pretty sure his family also didn't give up on him. That's the big thing.
Mm-hmm. Oh my gosh, that must have been very expensive.
Well, hopefully he had nice insurance. Maybe he was a politician. then we know he wouldn't have to pay.
Father of 5.
Man, that's amazing.
Right now, though, he's working to regain lost function in one hand. He had to relearn how to use his arms and hands, eat and swallow, and even do speech therapy. So
that's amazing.
I mean, it's going to be with him for life.
Yeah.
Wow. Well, we appreciate all of your great information and your time.
Thank you.
Thanks.
From the PIIC Center, infectious disease specialist, Dr. Vivek. Up next, we've got biking season.